UCSF's involvement in SF-HIP started with this idea we have these tremendous assets in research and other programs at UCSF, and they're not sufficiently connected to what's actually going on in the community to address health and health disparities in our local neighborhoods. So that was the motivation, is how do we not just stay in the ivory tower, but how do we take these great strengths we have and apply them much more directly to the needs in our local communities.
The San Francisco Health Improvement Partnership is a collective impact initiative that is made up of a number of folks from San Francisco representing many sectors: health, university, Department of Public Health, health equity councils, the school district, a number of partners that come together to improve the health of San Franciscans.
I didn't really understand when I began with SF-HIP what its implications were, but I certainly know them now. And I feel that this is an opportunity to really influence decision makers. It's an opportunity to shift resources to be more targeted in areas that have been neglected or have been overlooked. And I think it's also an opportunity for us to keep our eye on the issue of health equity.
The community health needs assessment process in San Francisco has really become an institution of itself, and I had noticed at times that a lot of energy was spent completing the assessment and identifying the needs, with not an equal amount of energy being spent on what we can do about those needs.
After looking at the data and engaging with the community and working with SF-HIP, we identified three major areas of focus. The first area of focus is on behavioral health. The second area of focus is on physical activity and nutrition. And the third area is on appropriate access to medical care.
So sugary beverages is one example of where we've brought scientists, researchers at UCSF in much deeper partnership with both civic agencies and community groups. Another good example would be around children's oral health. If you put fluoride varnish on the teeth of children when they're toddlers, it actually has been proven to reduce the likelihood that they're going to get cavities of the teeth. It's one thing to prove that in a research study. It's a much different thing to say, how do we actually get this done in every well child visit in primary care clinics throughout San Francisco, particularly those clinics serving less advantaged populations.
I believe that together we can have a tremendous influence. By being able to articulate a vision of health for San Francisco, collectively our influence can have a big impact.